There's a new procedure for people who have tried everything else to tame their lower back pain. KOLO 8 News Now's Mike Stephenson has this story.
Swift Institute's Dr. Hugh McDermott won't soon forget Harvey Smith.
Harvey has the best radio voice you could ever have.
Major Beau's amateur show.
A good voice coupled with a bad back, the product of retirement after nearly 3 decades with the California Highway Patrol.
I started playing golf 5 days a week for 10 years, and that's what herniated my disc in my lower back. It was hard for me to even put on clothes because I couldn't lift my leg up.
Surgery offering Harvey only temporary relief, as did everything else.
Acupuncture. I had 2 bouts of radiofrequency ablation. I had nerve blockers. I had cortisone shots. I had everything they could try.
Enter the Intracept, a minimally invasive procedure targeting the pain-transmitting nerve in patients specifically with chronic vertebrogenic low back pain or damaged vertebral end plates.
We figured out if we can get this device, which turned out to be the Intracept, in and around this nerve, which is called the basivertebral nerve, and we cauterize it, that signal would stop coming through.
Dr. McDermott comparing it to turning off notifications on your phone. Nothing structurally changes, just the message.
They just bore right into your spine, they stick an electrode or something in there, and it just fries the nerves. I was all excited. I figured I'll try anything.
Dr. McDermott was the first Northern Nevada physician to perform the Intracept at an ambulatory surgery center, and Harvey was his patient. One over the moon in the weeks following.
I didn't feel a thing. I think it's permanent. I'm constantly getting a little bit better with physical therapy.
This really works you down here?
Yeah. It's fun. It's really cool to see. I'm optimistic that that was the primary generator of his pain, and we treated his pain.
I called Dr. McDermott my hero. I mean, I didn't expect it to be that good.
In the 5 months since, Dr. McDermott performing multiple Intracepts on area patients, all reporting between 80 to 100% loss of pain.
Now you're using less medications, now you're more active, and those are the things what we've been trying to do the whole time. It just perhaps wasn't really possible for you, or we weren't in the right mindset of well, what's the point? It's just going to come back anyway.
This is conditioning me to say, hey, just shut your mind off to thinking about pain and just set your goals.
Like getting back on the golf course, something the Corvette enthusiast hasn't done since 2006. But thanks to the Intracept, Harvey says he plans to soon. In Reno, Mike Stephenson, KOLO 8 News Now.
Now, this specific pain diagnosis is new to the spine world, and so right now many private insurance providers still label the Intracept as experimental. But Dr. McDermott says that there's a process to get approved, and the more success, the easier it'll become.